Hello, I'm Kayla Roman, and today I'll be highlighting a top professional providing senior financial services, Matthew Hrycko.
Hi,
Hi,
Kayla.
Matt. How are you today?
I'm good. How are you today?
Good. Do you want to start off by just telling us a little bit about yourself, maybe your family, hobbies?
Just a little bit about the business and myself. I've been doing insurance now for 15 years. I'm in a market here in the area that I've sort of grown up in. My parents have worked in the area, so it's allowed me to, meet with a lot of people here that I've known in the past, help support this, local community here in Ellwood City. And then it also allows me to, participate in a lot of the events out there. My family and myself, we participate in all the, craft shows, art shows, etc. here in the area. I golf here in the area with some people. And, it allows me to not only help the clients in the area, but spend time with them outside of here. On a daily basis, I have, 3 children, ranging all the way from college to kindergarten. So it keeps me busy.
Yeah, that would keep you busy. That big age range. Can you tell me what led to you getting into insurance in general?
Yeah, I saw an opportunity. Like I said, years ago, I started in the automotive industry and I worked my way up, to running stores and such. But what it didn't allow me was the time to spend with my family. So looking out there and deciding what I wanted to do next in my life, insurance seemed like something I not only would be good at, but helping people, one of the things that I enjoy. And then it allows the flexibility to have a good work-life balance.
Can you tell me what led to you working with seniors on their specialized insurance needs?
Yeah, I kind of fell into it when I started in the industry. That was the first upline that I had was a group that specialized in the senior market. It's not easy to get started in. It does take some time, of course, to build up. But, I had a goal in mind of just, helping these folks and helping seniors in the area, because a lot of them don't know programs that are available to them, don't understand what they qualify for. So year after year, realizing that, it just helps you to create, a good rewarding feeling helping people out. And, so that's what's kind of kept me in it and kept the drive to keep helping as many people as I can.
Yeah. What are some of the biggest challenges that you see your clients facing regarding their financial situation?
The biggest challenge, nowadays, even compared to years ago, would be, most of the seniors are living on fixed income, and a lot of people may not realize that. So, they have very limited budgets and income and are really counting every penny during the month. So, some of the biggest challenges facing that is not knowing what they have coming now or in the future. So it's just important to make sure that they always have everything and that they qualify for, in their state, and to make sure that we always do what's best for them.
What are some of the specific goals that you can help your clients attain?
Most of our goals here, of course, are to preserve wealth. That's me and the partners, my associates. Number one goal is just to preserve the wealth that people have worked so hard for to attain their entire life. And by doing that and again, helping them maybe find programs that they qualify for to help with prescription drug costs and such, is one of the main goals that we try to help people with financially, because that's their largest cost in the senior market. Is always going to be prescription drugs. So that's always a large concern to them. So we're always trying to, make sure that we have all the things available to them and phone numbers, etc., to reach out and get the help that they need.
Without divulging any specific details, can you tell me about a time that you helped a client achieve one of these goals or overcome one of the challenges that we just kind of discussed?
Yeah, it's really on an annual basis, even especially this time of the year that we're talking. Seniors start to go into the donut hole or the coverage gap that you say. But gosh, just yesterday, one specific incident, I have a guy, the area I'm in, it's, there's a wide range of income. One of my lower income clients yesterday, had come down here very scared because, they're on medical assistance and such, and, barely have enough money to get by, and Social Security just decided to force them to begin paying their Part D premium again. So, we're working through that right now, in touch with Social Security and Medicare, because if these, these folks had their, that income taking out of their check every month, they won't be able to survive. And that's one of the challenges, is actually just dealing with, and things that I can help you with, dealing with the agencies, believe it or not, Social Security and Medicare themselves, with the mistakes and even the challenges of trying to find somebody who's willing to be in a good mood and help you that day at those offices. So that's the challenges, but it's just persistence pays off really there. So
yeah. If you had a crystal ball and can see into the future, what do you think is going to be the biggest challenge facing the senior financial market in the next 3 to 5 years?
So the biggest challenge would be, I guess, the unknown for them. As we continue to go forward, the costs of what they call their Medicare insurance and the cost of the drugs and everything else seems to be going up, while their income being on a fixed income is most likely staying the same. Even with their pensions, retirements, et cetera, they're not what they once were even 12 to 24 months ago. So just making sure that they pay attention and have as much information as they can moving forward will be one of the biggest challenges, and making sure that the carriers themselves can stay competitive.
Well, those are all the questions I have for you today. Is there anything you want to share about you or about what you're doing before we jump off the call today?
Yeah, at Insurance Benefits of Pennsylvania, really, we just try our best every day to help, each and every person that we can. Again, I'm in an area that, needs the help, especially, like I said, with seniors here in the area that don't know maybe some of the things that they may qualify for. So each and every day, we just try our best to do what's best for the members, beneficiaries. And, this is something we not only do that day, but for the rest of their life. So it's something that we take pretty personal, and we're always here to help.
Great. Thank you so much, Matthew, for your time today. I really appreciate it.
Thank you.
All right. Thanks. We'll talk soon.